Okay, I think we're ready to start. So, hello everyone, and welcome to yet again another IBD&Tea live debate organized by New Deal, a research project funded by the European Commission, focusing on the development of a new nanotherapy for inflammatory bowel disease. My name is Kira Keini. I work at Science Communication Agency ScienceSeed, which is one of the partners of the New Deal project, and I will be moderating our discussion today. Today we'll be delving into the topic of psychological impacts of IBD and what kinds of effects living with chronic illnesses like IBD can have on patients' mental well-being. And discussing the gut-mind relationship are very interesting. First, we have IBD patient, researcher, and psychologist Guido Corradi from Universidad Camilo José Cela in Madrid. Welcome, Guido. Then we have Meredith R. Craven, clinical health psychology resident at San Francisco VA Medical Center, specialty in psychogastroenterology. Welcome, Meredith.
Thank you.
And last but definitely not least, we have presenting the New Deal Consortium, Dr. Julian Panes, Chief of the Inflammatory Bowel Disease Unit at Hospital Clínic de Barcelona. Welcome, Julian.
Thank you. Hello to everyone.
And to anyone watching the live stream of this event on Zoom or Twitter, you can send in your questions in Zoom via the chat. And in Twitter, you can answer to the publication with this live stream. And I will try to share as many questions as possible during the event with our speakers. And the event will be recorded and shared on the New Deal Twitter account at New Deal EU. And to our speakers, if you have any questions or comments that you want to share regarding your fellow speakers' speeches, please raise your hand and I will try to share your thoughts. All right, without further ado, we'll start. First off, I'm going to ask our speakers to introduce themselves briefly and explain your connection to today's topic. So please, Guido, could you tell a bit about your background and experiences with IBD?
Hi, I'm Guido Corradi. I'm a researcher at Universidad Camilo José Cela in Madrid, and I'm here, I think, because of two different things. The first one is I am a psychologist researching in the impact of public bathrooms on quality of life of people, especially people with IBD. And also because I am a patient of IBD. I have ulcerative colitis from 10 years now, and of course it's a topic that is it's really appealing to me.
Great, thank you for the introduction, Guido. Meredith, so you're specialized in psychogastroenterology. Could you please explain what this means in practice and how you came to specialize in the field?
Yes, of course. Hello, everyone. I'm Dr. Meredith Craven. I attended Northwestern University, where I got a PhD in clinical psychology, focusing on gastroenterology or psychogastroenterology. So when you work with someone who is a health psychologist who specializes in psychogastroenterology, we help people with a range of digestive disorders, including inflammatory bowel disease. So we use evidence-based therapies like cognitive behavioral therapy or hypnotherapy to help patients learn to better cope and manage these types of conditions. And we can also typically find a lot of benefit for different types of symptoms, especially in disorders of gut-brain interaction. But specifically to inflammatory bowel disease, I'm really interested in well-being. And so I'm so excited to be on this panel today talking about how we can encourage and promote well-being even in the context of this difficult disease.
Great to have you with us, Meredith. Thank you. And then Julian, how about you? How did you come to specialize in IBDs, and what would you say is your connection to today's topic?
I specialize really in gastroenterology, but very soon, and this is more around 30 years ago, I focused my clinical activity and also my research activity in IBD. And what attracted me is the concept of multidisciplinary team organization to take care of patients with IBD, because when we started about 30 years ago, the multidisciplinary team was mainly surgeons and physicians working together. It became very soon apparent that nurses had a very important role in the daily care of this patient, that we need to meet with pathologists to provide also accurate diagnosis and to discuss difficult diagnosis. And I have to say that it was too late that we realized that psychologists should be also part of this team, because those patients, every patient with a chronic disease may have a deep psychological impact, but in particular, our patients are young patients that have a disease that with an unexpected course over time, that it may a flare, they may suffer a flare in the worst moment of their life, and that creates a lot of anxiety and uncertainty. So it became apparent that we needed to take care of this part of the disease also, and I'm glad that we can discuss particularly today this aspect of the disease.
Great, thank you so much, Julian. Well, thank you all for the introductions. If we move on to our topic in more detail, I'd like for us to start with a little clarification of what the gut-brain relationship actually means. Meredith, could you provide some insight into what that refers to?
Yes, so the gut-brain connection refers to the constant communication between the brain and the gut. So they are in constant communication, sending messages back and forth through chemicals and nerve endings. And this communication can actually influence our physical and psychological state. So for example, our stomachs may begin to rumble when we smell something delicious, or if we feel really anxious, we may feel nauseated. And there's more and more evidence showing the influence of this connection within IBD. So we believe that the brain-gut connection plays a significant role in the relationship between IBD and increased risk for anxiety and depression. There's also evidence to show that chronic stress, when a person with IBD experiences chronic stress, they may have more significant pain or changes in motility or movement because of the brain-gut connection. So it's something really important and something that we also focus in on in therapy.
Great, very interesting, thank you. Well, Guido, as a person living with IBD, a bit about your experiences. Has living with a chronic illness affected your psychological well-being in some ways?
Yes, totally. I remember the first time when I was diagnosed, and my life changes in other ways, and I was in a total denial of the illness, because a chronic illness, when the doctor says, okay, now your life will be totally different, it's an impact. It's an impact, and you don't want to believe that the course, the entire course of your life is changing like a giant river that is supposed to go to one direction, and now is going to a new one, to an unknown one. So as everything changes, I have to leave my job, because I was in a university at that moment, and I was working for paying my university, and I was working as a delivery, a pizza delivery, and I was I was not capable to doing deliveries, because I needed a bathroom constantly. Um, I was really lucky, because I found job in the research, in the research team, which is as doctoral student, and is totally a place where you can compatibilize your academic work with going to the bathroom like one time each hour. No, it's and how it's affected my life. It's affected in several ways. I did my PhD, but I had to. I couldn't go to, as an example, I couldn't go to for any internship outside my country because I was constantly being in the hospital, so it was not realistic to think about going outside. Also, the coping mechanisms um, uh, make me to focus on make international contact with another wonderful researchers to overcome this limitation because then the evaluations is like why you didn't have international experience. Okay, I couldn't go to England, I couldn't go to Germany, but I worked with people from every part of the world. This is I think linking with what Meredith said that these coping mechanisms, this psychological support that my colleagues, that my nurse gave to me is fundamental in your life as a patient. I have to point that the way in which I took for a lot of time this kind of medications that you have to go to the hospital and being the whole morning and talking with my medical staff, my especially with my nurse and talking with another patient was what I think it kept me alive because also I had I think psychological well-being and the illness is like a cycle because when that our illness impoverish our quality of life and the impoverishment of your quality of life affect the way in you are handling your illness because I remember in 2016 that I was really bad and I was so bad physically that my psychology um, started to being really bad and I started to restricting my eating because yes, talking about this is like maybe you will think that I'm really silly, but you have to put in the situation. I wasn't really in a terrible situation. Also, in my family, the things weren't well, and it's like a cycle. And when my nurse and my mother broke the cycle of okay, you are bad, you are feeling physically bad. This is leading due to behavioral change that is not helping to you. Instead, they are your behavior is making your body worse because I started to eating really eating a lot less and only cheese sandwich, not a healthy and not a good thing for our guts. And this informal psychological support from my nurse and from other patients and also from my mother, which broke the cycle, is what made me think about the power of psychology in a health context.
Yeah, kind of realizing that everything connects.
Yeah.
Yeah. How about you, Julian, as a medical practitioner? What Guido has just explained, how do you think about that? How do you think the connection between the mind and the gut is currently being considered when treating IBD and other?
I like particularly the very precise words that Meredith Craven used to describe this relationship. which is exactly the perception I have. Uh, Depression and anxiety may increase the intensity of perception of symptoms such as pain. I mean, the same stimuli, and that happens in humans and that happens in animals, the same, okay? And we have studied that very well because you can measure the intensity of a painful stimuli that you can inflict to a laboratory animal. And when this animal is under stress, the pain inflicted by the same intensity of the stimuli is perceived as stronger, okay? And I think this is something important to understand, because we went through the process of asking our patients if they perceive that stress would worsen their disease. And 70% of them asked affirmatively. 70% of them have the perception that stress worsens the disease, and how and I would say that we have to kind of put that into context, because clearly if I have Crohn's disease and I have pain, which is one of the main symptoms of Crohn's disease, if I enter a situation of stress, I will feel my pain as a stronger pain, but I won't have more inflammation. My lesions, the severity of my inflammatory lesions won't change. We can discuss that later, because there are some contradictory studies about the influence of anxiety in inducing flares of the disease. The studies are very contradictory. Our studies that we developed together with psychologists in our unit were negative in that regard. We couldn't show that live events or stressful situations would induce a flare of the disease. But no doubt that if you have pain or if you have diarrhea, your symptoms may worsen under condition of stress. So I understand perfectly that the patients have the perception that stress would worsen their disease. What in reality, what happens is not an increase in the severity of inflammation, in the severity of the lesions, in the damage that the intestine has, but really a perception of a higher intensity of the symptoms. And I think this is important to understand, because some patients even blame themselves because they are facing a stressful situation and they feel responsible for having facilitated the start of a new flare, which is, I would say, not the case. I would say it's almost never the case, but it's just the situation that in a stressful situation, you feel the symptoms as more intense.
Actually, we have an audience question related to this, what you just mentioned, Julian. So we received this question that goes, are psychological impacts different from psychological triggers? Anxiety, depression. Who'd like to? Meredith, would you?
Sure, I can answer that. So I would say the short answer is that they're related. So we know that IBD can be very stressful due to a variety of factors, including inflammation and poor coping. And we also know that people are at increased risk for anxiety and depression. So we know that anxiety and depression can increase one's risk for flare, and at the same time make it harder to engage in those important healthy behaviors like taking medication regularly. So it's really kind of this intertwined cycle of, IBD can cause a lot of stress or increased risk for psychological comorbidities. And these comorbidities can just make it that much harder to take care of yourselves, and also has some physiological impacts on your body. But I think what Dr. Panes was also referring to is that we see a lot of overlap of irritable bowel syndrome in IBD. So there can be experience of similar symptoms like pain or diarrhea, and people may think that they're in a flare, but they actually may have this overlap of a functional disease or a disorder of gut-brain interaction that's also actually very sensitive to stress.
Thank you, Meredith. And then to another issue regarding this. So some IBD patients go through an ostomy surgery and use a colostomy bag, which can take some time to get used to. So what kinds of effects can this, for example, on a person's mental well-being? Guido, what do you think, for example?
My experience with these situations is like I live ostomy as like the final solution. No, I'm always making the numbers of how much, how many medicines can I take before I have to start thinking seriously about any kind of intervention. And all patients I meet, I think like me that is the fear of the ostomy is probably worse than the ostomy itself, because some friends that has had temporal ostomies, they didn't. They told me that they were really scared about, and when it came, it was awful. It changed their life, and they were subjected to a lot of self-shame and other psychological processes. But it was it's not it wasn't as painful and bad as they think they were. So I think there's a lot of expectations that play a role in the different treatments, and I think sometimes the sanitaries don't have the time to explain to you how it will become, because they are subject to a lot of time pressures and scarce resources, and they don't have the time. They have the intention, but they don't. I think they don't have the time to talk quietly to you and say, okay, this is what we have. This is what how it will be, and there are some other patients that think says these things about this treatment, and the perceptions are, and I think it will be a good improvement in the by the sanitary side of the illness.
Right, Julian, you had a question or
Yeah,
comment?
and I wanted to ask Guido. I mean, it's not just a justification for not explaining the patient sufficiently. Of course, I agree with you. We would like to have more time, but the number of IBD patients is increasing. The time and the doctors that we have devoted to IBD is not increasing at the same rate. We try to compensate that by having nurses that can explain. But my question was, what I've seen in many of my patients is that when I explain them that they will overall their quality of life will improve with an ostomy, because my perception is that living with an ostomy is something that you can bear more easily than having abdominal pain every day, or that having incontinence, for example, if you have ulcerative colitis. But of course, I have not had an ostomy, and I cannot tell my own experience. And in that regard, we have some patients that are very good at communication in our unit. It's not that, of course, I tell the patients about patients associations. Of course, I tell them about this, but I don't tell a patient, go to the patients associations and ask there. But we try to connect patients with others, and particularly some ones that are very good communicators. Some of them had high profiles on social media. And when this information comes from a patient, I think that is easy to understand and to believe that what has been the experience of that patient is probably also what will be your own experience, more than what I can tell as a physician to a patient. What do you think?
I totally agree with you, Julian. I think I have very good memories in when I was living in Palma, because the hospital was smaller than the one I come to here in Madrid. And these good memories are in part because in the daycare hospital they were like a um, like a group, because this contact with other patients are learning from other people who um, they were in your situation, and they told you about how their life is changing, how to deal with really stupid things in your life, like I'm going to the center, I don't know where are the good public bathrooms to go. So sharing this kind of information is really is necessary. And also you learn as a patient when you talk with other patients, maybe some new one that this is the first time the first dose of vedolizumab or some this kind of treatments. You make a complete reassessment of your situation, because you see the new ones are like little birds and it's when you realize that you was a little scared bird and now you are flying, and you have a complete reassessment of, okay, maybe I feel really bad, but I'm better now than 3 months ago, because you take like a longitudinal perspective of the illness. This contact with patients and with also with all the medical stuff, of course, is what makes you reassess your life, mostly in a positive way.
We delve into the topic of communication between patients and physicians. Meredith, would you have any advice for physicians on how to approach these topics with patients? Are there any certain questions, for example, that they should ask, or
generally, or related to the ostomy?
well, in general, yeah.
Yeah. So there are a few good publications around patient-provider communication in gastroenterology. There was a 2018 best practice paper by some of my mentors, Dr. Kiefer, Paulson, and Pandolfino. And in that paper, they're really focused on using open-ended questions and regularly talking with patients about quality of life, about well-being, and about impairment. So some questions that you might want, the provider might want to ask is like, what would you be doing differently if your symptoms were better managed? Or how is IBD getting in the way of things that you want to do? So thinking about what are some open-ended questions that I could ask my patients to better understand more of the big picture, more of the context, like what's important to this person. And also it can help physicians start to identify, who's at increased risk for anxiety and depression. Because as you start to hear patients talk about all of the different ways that they may be feeling impaired, that's kind of giving hints to you, oh, maybe this person needs more support.
Thank you. Well, Julian, yet again, from a medical practitioner's point of view, so what would you say is most difficult about this interaction between patients and physicians?
What is more difficult? I wouldn't say it's one of the more difficult, but I would say one of the important aspects in this relationship is to build mutual trust. Okay, and uh, and for that we are in a situation in which we don't have wonderful treatments, and our best treatments will achieve a good control of the disease in about 30% of the patients. That means that when we start a treatment, we have more possibilities to fail than to be successful. This is the reality of the situation of IBD today. And you need to tell the patient that you have a plan, you have a therapeutic plan, that I don't have a wonderful drug. I cannot ensure that a certain medication will be effective for that particular patient. I don't have predictors. We don't have predictors of response. And it is important that the patient understands that we have a plan, that we may fail in our first step, but it's not going from failure to failure, it's following a plan. If that works, we will stay for that much time under this treatment, then we will try to lower the intensity of the treatment or to change to a more tolerable or safety treatment or safer treatment, you know. But if that doesn't is not effective, then our next step will be B or C or D. Okay, so I think that making the patient understand that you have a plan, that is a very important aspect in building confidence. Also, another very important aspect is in having an open access for the patient. I mean, this is not, with all the respects, this is not chronic hepatitis in which we'll measure transaminase level every 4 months. Okay, I may see a patient today, he may be perfectly well, he may have perfect biomarkers, and 1 week later, he may be in a condition where he needs to be hospitalized. Okay, and what he needs is to know that when she doesn't feel well, she, she will get in contact with us and we will provide immediately on a daily basis an advice. I mean, I think that this having a plan, having easy access and feeling and making the patient understand that we are a group of professionals that can take care of every aspect of the disease. Those are aspects that are very important. I think that each one of them is important. Each one of them is difficult because you have to build an organization and a structure that provides all these or that fulfills all these patient needs. And I think that each one is important in different situations, in different aspects of the disease.
Do you agree on the fact that trust is key? What difference does a good trust or good communication between patients and physicians make?
That was a question to whom?
Sorry, to Guido.
Okay, yeah, I totally agree. Yeah. I was thinking about this in a situation in which my nurse gave us gave us her WhatsApp number, so it was really this open ending Julian talk us about. It was really illuminating because I remember that in Palma, in my previous city, the nurse gave a phone number in which you sent your questions like, okay, Thuri, I have this in the skin. What I have to do? And she said, okay, go go take it easy, but in this week come to see us. Or I remember one time I was hospitalized at like 4 a.m. in the night, and I sent to my nurse a message. I said, okay, I'm in the hospital. See you later. And she had when she arrived at 8 o'clock, she asked to the hospital to do some kind of weight analytic that then was a key for this analytic was really important to how to say to inspect what happened to me because I had a bad reaction to some medication. But this kind of information only knows your nurse, your medical team. So if I hadn't maybe if I hadn't this open access to my medical and open and easy way to contact my medical team, I wouldn't have this precise diagnosis and I think is totally a key. Just sometimes also you feel psychological secure just knowing that if you need, you can uh, you can make a phone call and having attention, or you you go through your life with much more security.
Mhm.
I think is totally a key.
Well, what if there isn't that kind of psychological security, Meredith? What's kind of the worst case scenario? What if a patient doesn't feel comfortable, for example, with the people who are treating them?
Yeah, I think, that trust is so important for many reasons. We know that patients have a more difficult time adhering to medical advice or medication when they don't really trust their providers. So, what it really could lead to is just worse disease course or worse symptoms. So, we really want to avoid that. And I think it sounds like there's been, such positive experiences for Guido, and Julian is really focused on that team-based approach. And I think that's what patients really value is feeling supported by a team, knowing that people are listening to them and know more about them than just their disease, about like what's important to them.
Okay, thank you. One more audience question. Actually, we received a patient, I'm assuming, has asked, can therapy improve IBD? Who would like to take this question? Meredith?
I would love to take that question. Yeah. So with the research in this area is still growing, but our results are pretty promising. So we know that cognitive behavioral therapy can really be helpful for quality of life and coping skills. There has been some research to demonstrate that hypnosis can be particularly helpful for ulcerative colitis in terms of prolonging remission. And there's also research demonstrating that mindfulness can be really helpful for improving anxiety, depression, and quality of life. So this field is really growing, and more research needs to be done, but it's quite promising, especially around those coping skills and mood.
Right. Thank you. And actually,
I just want to add,
yes,
I
please.
totally agree with what Meredith said, and also to patients don't rely on also on these informal networks of people who are willing to help you, because as a patient, I sometimes I felt like I was more lonely that I'm really was, because you enter to thinking about you are miserable, you have a lot of problems, um, people don't want to adapt their things to you, but then not always is the case, and you will find that there are more people willing to take care of you, and you can rely in these kinds of informal I call it like informal therapy, because then your friends, your nurse, other patients, we are part of a network of people helping each other, and among these say that Meredith said about like formal therapy and formal networks rely also on don't give up in in the um, in the social things also. Just a point.
Yeah, very, very powerful point, actually. So thank you a lot. Anyone want to comment on this? What Guido said? No? Okay. So far we've discussed what the gut-brain relationship means and what difference a good communication and decisions makes. So let's focus now on how we can actually improve patient mental well-being and how to take it best into account. So Guido, as a patient, do you think that you have received the mental support that you've needed throughout the years?
It's a paradox that I was a psychologist, but I didn't take care of myself in the psychological aspects until the more recent years. I think the sanitaries, they have a lot of willing to take part on your psychological adjustment to the illness, but as Julian commented before, there are not resources for it. And also, it's like we are thinking in two different worlds, like physical well-being, psychological well-being, and research says that they are interrelated. That also the World Health Organization also talks about these interrelations about quality of life in physical, environmental, and different aspects, and the interrelation. But I think it could be a lot. There is a lot of things to be done, and I hope the resources to do will be coming in the next years, because it's really interesting. Also because if you don't have the psychological support, maybe you will tend to leave medication. There are a lot of studies in psycho-oncology, and also we are now in Madrid doing some research about depression and anxiety, because people get depressed and they start to feel helplessness, and they stop their treatment, and this is really it's really a danger, because leaving your treatment is the worst thing you can do. And also as you lived as we studied it in an oncology setting, but when people start to leave the treatment, they start to feel worse, and this also have an impact on psychological well-being. And it's like you are leaving the train to pass instead of jumping it. And as the train gets faster, you get it's harder to get on it. So really important is this psychological well-being. And there is a lot of will by the practitioners, but I think there is not there are not enough resources to do it.
Thank you. Well, Julian, what do you think? What kinds of things should medical practitioners consider when treating IBD patients? What kind of mindset should they have in these situations?
Well, I think that what Guido mentioned, that as a gastroenterologist, or we tend to look at inflammatory lesions in the gut and try to heal ulcers, and this is very important, but this is not all. And as Guido said, we really, at least and if Guido is in Madrid, he is also suffering that. We have a real shortage of psychological support for chronic patients. and usually, I mean, it is considered that patients with other conditions, such as, for example, patients with cancer or patients with certain addictions, of course, they are in high need. And IBD, I would say, in a majority of Spanish centers, is not a priority when allocating these resources of psychological support. And it is clear that we need to cover that need if we want to improve the quality of life of our patients, and patients have all the right to live better quality of life. But it is our responsibility, as in most of the medical care in Spain is provided under the coverage of social security, so it's public health. And I think that of course a patient that is using public health should have the same right to have psychological requirements or psychological support as patients in private practice. But we have limitations for that. And in that regard, I would say that working together with patient associations to request to the policymakers that really allocate resources to that psychological attention is maybe the best strategy, because I would say that probably patient associations have a stronger power than health organizations when requesting the politicians to allocate resources. And I think that we should work together with patient associations to improve that aspect of care.
Well, Meredith, is there anything that patients can do? What can they do to cope better with anxiety, for example, or difficult feelings or thoughts?
Yeah, well, first off, I just really want to agree with that comment of how important it is to address all the different levels of context, including policy, of making sure that patients have access to mental health resources and support, and how important it can be to work with patient organizations and policymakers. But in terms of the individual level, you know, exactly what Guido was saying about getting social support, that's so important, of having people around you who care about you, who enjoy your company, and who you can also get advice from. You know, another thing that we pay a lot of attention to is the connection between thoughts, feelings, and behaviors. So patients start to often avoid things that are important to them. They'll avoid, you know, weddings or traveling because they're scared of being embarrassed. So we're noticing that there's a connection between, you know, they're making a prediction that they may have an accident and they feel anxious or embarrassed, so then they avoid. And we really want to help patients understand that you don't have to avoid everything. And when you start to do that, that makes you feel worse and can also just make it that much harder to do health behaviors. So really paying attention to what's important to you and how can you still, you know, maintain a good social life and engage in meaningful activities.
I'm curious, has the current coronavirus pandemic affected patients' mental well-being in some way? Have you, all of you, noticed the effects of the situation? Guido, for example.
I think there is some paradoxes, because nothing is better for an IBD patient to stay all the day at home, so, and working at home, and for in that way, I think was totally it was good, because you can control your symptoms at home, but it comes with another. Is like the only positive aspect, because when you leave to when you start to work outside, you feel like your company is okay. I demonstrated that I can work perfectly without at home. Now you are, and it's better for me. Now you are asking me to expose myself and to go into public bathrooms instead of in the one I have in at home, these kind of things. Um, and also when you go outside, uh, you have less public toilets available. But talking with people for some research we are doing, there is like some opinion that they are less, but they are slightly better because they are less used, and um, bars and all and educational centers are taking care of taking it, making them clean. So there are some positive aspects, but of course, it's like this pandemic fatigue is like another stone on your back. People who are coping with chronic disease. We have too much stones in our back, so putting this extra is also is problematic. I think is like an extra for the population who is now in suffering this psychological impoverishment of the well-being. So very very little things good, a lot of them bad, as my conclusion in this topic.
Julian or Meredith, do you want to add to that?
Yeah, I think that an aspect that I perceive from my patients is that the situation has led us to change a vast majority of our visits to teleconference visits or phone visits. And something that I think patients or we don't provide maybe the same support or the same feeling of closeness with a telephone visit than in a face-to-face visit. And I perceive that many patients miss the face-to-face visit with a more direct contact with the physicians, and that it's another contributor to worsen a bit their psychological condition. Even if I will tell the patient, I may tell the patient the same in a phone visit than in a face-to-face visit, but the closeness and the eye contact, I think that those are important aspects also in patient care that patients are missing during this pandemic due to the change in the format of the visits.
Meredith, do you want to continue on that line?
Oh, I feel like they really covered it well of just, we are seeing an impact on well-being. And I think it's just really important for patients to just continue to take care of themselves the best that they can.
Actually, there is a question we've received. This is to Meredith. How important is awareness about IBD and its symptoms among those who are not suffering from IBD in the context of providing support to patients' lives and in turn their mental health?
Mm-hmm. Yeah, I think it honestly is really patient dependent. So some patients or people with IBD want to share a lot of details with their loved ones or their social support, and they feel like that's really valuable and helpful. And other people tend to be a little bit more private, and they may share that they have the condition but don't want to talk a lot about the symptoms. But even just sharing that they do have a chronic condition can bring more support. So I think it's really, dependent on the person. And at the end of the day, we just really want people to get support. And that can sometimes involve a little bit of vulnerability and sharing that you at least have this condition and may need to make some changes in your day-to-day living, like knowing where a bathroom is or, needing a little bit more time.
Yeah, I totally agree with Meredith. I when I was starting my illness, I was very shy about it, and I didn't talk about it, and I didn't share it in any way, and this isolates you a lot. I understand that everyone have their own experience, but my personal one is that I feel very isolated, and then I started. I don't know why I started to change my point of view, and I started to talk it in and sharing it in social media, in also with in informal context, and having a date and talking about that. And because, okay, if we are going to have something, you have to know that my life is a bit different, and the best I can do is talking it at the very first, because it's part of me. And now I made a big change in that. And as an example, when I teach at classrooms, the first day I talk openly about it, and I talk to the students, and the feedback you get is you think that it would be worse, the worst, and they will think that you are such an idiot, and this kind of thing. But actually, the feedback is more positive. It's more positive than negative, and my experience is that also students talk about that, and they say, yeah, I have some also I don't have this disease, but I have this problem, so I understand you. And it's I recommend to anyone to talk about it. And if they feel very shy, try to talk first about with other patients, and or under a nickname in a Twitter account or this kind of thing, because the this informal support, I think, is totally important. Is totally relevant.
Definitely. Thank you, Guido. We're running out of time soon, so I'd like to ask one final question to our speakers. What would be, based on this conversation we've had, what would be your key takeaway messages for people watching the event? How should the mental well-being of patients be better taken into consideration in treatment? Julian, would you like to start?
Uh, well, I would think that having accepting the disease, accepting that the disease may impose some limitations, but that together with the IBD team, with the IBD unit, we are part of the team. And as we say using a Spanish expression, we are in the same ship, flying or navigating in the same direction, and all we are members, and each one has a part of the work in bringing that ship to the destination. So together, working together with the patients, covering all aspects, including these very important psychological aspects, which we will fight to have better coverage in the future. I think that the feeling of being it's not a patient going to an IBD unit, but a patient working together with the team as part of the team, really to improve the disease. I think that this mindset is important to take into account, and that will really improve the outcomes, and will lower, I would say, the anxiety if the patient has really the perception that she's not alone, but part of a group working together.
Nice way to summarize it. Meredith, what would you say as a final takeaway?
I agree about the importance of having a supportive team, including your providers and family and friends, and also realizing that you are so much more than just IBD. There's so much more meaning to your life outside of this, and it's important to recognize and find that.
Final words for today.
I lost you. You asked to me to
Right.
final words?
So
Okay. My take-home message is if you have a disease, take a time, separate the time of your day, of your week, of your or of your month, just to think about what can you do um, to achieve a better quality of life. Don't isolate yourself. Don't think your psychological aspects are not important. Put it in the center of your life just for a moment, and it will bring you uh, coping mechanisms, evaluation of the situation, etc.
great. Thank you so much to all of our great speakers. I seem to have had some audio problems, so I apologize for that. But it has been wonderful to talk to you and hear your thoughts on the topic. And to anyone watching, the event recording will be shared on the New Deal Project's Twitter and YouTube account, so you can follow the project on Twitter at New Deal EU and read more about the project also at the webpage of the project at newdeal-project.eu. And thank you so much for your attention, and I wish you all a lovely rest of the day.
Thank you.
Thank you.